Hello, I'm Lisa Ling, and this is The Road to a Vaccine, a weekly live educational series exploring the COVID-19 crisis and the global community's efforts to develop a vaccine against the disease. The world looks very different than it did even a month ago. We've gone from 1.6 million global infections to 4.1 million cases worldwide, and that's just in the number of people who've been tested. Things continue to change daily with this disease, and we are doing our best to keep you apprised of the most up-to-date scientific information. Now, May is Mental Health Awareness Month, and while scientists are working around the clock on a vaccine, many experts are warning that mental health is becoming a global pandemic of its own. Today, we'll be joined by the one and only Arianna Huffington, and she'll be here to talk about mental health, resilience, and how we can thrive in the midst of COVID. And we'll also talk about her new initiative to help healthcare heroes. And if you've ever wondered how clinical trials work, and I know I certainly have, you don't want to miss our conversation with one of the lead scientists in charge of J&J's vaccine clinical development. Now, please share your comments in the comment section and questions, and I will try to do my best to answer them throughout the show. Now, today is International Nurses Day, and the International Council of Nurses recently released a sobering statistic. So far, there have been 90,000 healthcare workers infected with COVID worldwide, and the disease has killed over 260 nurses. For their perspective today, we have two leaders in their field, Rebecca Love, nurse and president of Sanciel, a nurses organization that mobilized a major grassroots effort to provide life-saving PPE for nurses. And we have Nicole Lincoln, Senior Manager of Nursing Innovation at Boston Medical Center. Rebecca and Nicole, welcome to the show. It's such an honor to have you. Rebecca, I want to start with you. Now, early on, you mobilized nurses and towns in a huge grassroots effort to collect PPE donations from non-hospital locations and distribute them to frontline healthcare workers around the country. Yet we're still seeing so many stories of healthcare workers having to reuse masks and saying they don't have enough supplies. So do you believe that nurses have enough PPE, Rebecca?
So currently, I don't think so. I think that there's still a dramatic shortage. And to speak to that point, just this morning, I was on a phone call with one of the leading nurse innovators in the United States, one of the most major hospitals in the US. And what she was telling is due to the shortages, due to the price and cost, they're actually working on innovation teams to develop their own masks within their hospital systems, because masks they used to pay 7 cents for are now costing $3 to $17 a piece. They can't afford to keep going those ways due to the shortages they're seeing. They're actually turning to making their own masks in their own institutions. In our current initiative that we've been doing on moving PPE to the front lines, we have over 300 requests from hospital systems and nursing homes across the United States asking for donations of PPE. We still see it as a major shortage, even to the last interview that was done at the White House by the president of the American Academy of Nurse Practitioners, stating that she's been wearing her own N95 mask for the last several weeks. We know that the way things were before COVID-19, the way we would use PPE is not the way we use now, and we're still seeing, unfortunately, sustained shortages across the United States.
And Nicole, can you share your perspective on this? Do you feel the same, that nurses and healthcare workers are not equipped with what they need?
Well, I feel very lucky here at Boston Medical Center because we have had the basics. I do agree with Rebecca that we're not using it in the same way that we were prior to COVID, because we are reusing the N95 for the shift, but we had nurses innovate on ways to safely do that, along with the infectious disease nurses here at Boston Medical. And then we've had a lot of colleges and companies step up to make PPE for us, like the face shields. MIT has made them and donated them and is now selling them to hospitals. Ford and other car companies and such have been participating, like making gowns out of recycled airbags. So we have gotten the PPE that we needed, but that took a whole lot of work and a dedicated team to search out that PPE on a daily basis and deal with shortages as they came up.
You all have done such incredible work and just have really risen to the occasion on this. Rebecca, nurses on the front lines are forced to play so many roles in serving not just the medical needs, but also the emotional support for patients and families who are unable to be together as a result of the virus. So do you think of your job differently now than before COVID? And what kinds of new ethical dilemmas do you face in administering care?
So I think that nurses definitely see their role differently. And I think that what we're seeing at this point is care has changed dramatically. COVID-19 hit, and the way that we practice medicine dramatically changed to how we do today. The infectious rate with no treatment and no vaccine, what that meant is that we had no way of knowing the patients that we were going into seeing, what we could do to make them better. And the truth is what we had to do was our basic policy was infection control, protecting the patient, protecting you as you go in and care for patients. Fundamentally, that meant that we could not be in with the patients as much as we would normally be. And that fundamentally has made nursing be very efficient, very targeted, but at the same time, not lose the humanity of what we see in a patient. For nursing, patients has always been more than just a disease state or an illness. They've really been about who that person is and who they were before they got sick. And so we recognize the humanity of which they are. And I think what COVID has done is how do you bridge that gap when you deal with this infectious disease that potentially we don't know if we're able to catch it or not, and what kind of ways and best ways to go in for lengths of time. But how do we manage that human to human interaction as nurses by the bedside when you're dealing with such a situation of unknown, and keeping that human, that real center focus on the patient being first, I think is what we're seeing. And I know Nicole has incredible experience seeing this as well.
Nicole, when you walk into a hospital room with patients who have COVID, what is your first thought as a nurse?
Well, I think the nurses are the most courageous people I know. They're not thinking of themselves at that point. They're thinking of the patient and being there for this patient that's obviously frightened to death. They've got coronavirus. They're alone. They have no family with them. So the nurses become the family. The nurses become that connection to the family. Whether it be with the iPad, or I know plenty of nurses here have started asking for a lot of photos of the family to keep the photos with the family members all the time. And Rebecca's right. We have to be conserving of, the amount of times the nurses is in the room because of exposure risk. So I think it's very difficult philosophically for nurses, and just the heart of what nursing is to be with their patients as much as needed and as much as possible. And so I think they've come up with so many creative ways to do that through baby monitors, through iPads, through pictures, and through just connecting with the patients. And I know that nurses they still are holding the hands of these patients when they're very sick, and they're just not going to separate themselves from the core of nursing.
It's so moving. And Nicole, I know you've both seen some incredible stories at your hospitals of just the strength of the human spirit. Are there any particular stories that you can share?
Well, there was a really nice story. A young gentleman was admitted to Boston Medical Center, and he had a new onset of a very serious heart condition and was pretty fearful. And nobody can have visitors right now during coronavirus, whether you have the infection or not. There's a strict no visitor policy. And so he was, he was alone, and he was in love, and he confided in the nurses that he wanted to propose to his girlfriend, and they helped to arrange a plan with him, and they took him outside on discharge, and his girlfriend picked him up, and he proposed right here on the hospital grounds. So the nurses got to be a part of that joy, and I think that's what we look for every day. In all of the sadness around us, we look for the little pieces of joy, and we share them with each other, and we celebrate every time a patient is discharged alive. We play, a song, and everybody gets excited for the success that we're having in all of this, and the teamwork, and the togetherness, even when we have to maintain social distance.
What a beautiful story. I mean, it really takes a special kind of person to become a nurse and hold your patient's hands through this. Rebecca, what do you think it'll mean for the nursing community when we do have a vaccine?
So I think that a vaccine means the ability to look at this disease in a state and know that we have an end game in sight. And what that means is that we're going to be able to treat patients differently. We're going to be able to look at our profession differently. And we're also going to feel more confident in going in and crossing that threshold. What we realized in this crisis was in COVID-19, the way that hospitals were run, the way that nurses engaged, it became essential that nurses were brought to the forefront of managing this crisis. Without treatment, without understanding of this, the knowledge that nurses have, their understanding of the healthcare system by which to navigate and create new solutions at dealing with a very terrible disease was absolutely fundamental in getting through this crisis. And prior to COVID-19, the hospital system really was managed by verticals. You had administration, physician, and the nursing. And what you've seen through COVID-19 is a tremendous reworking where nurses rose to the top. And one thing that you know about nurses is they are experts in many things, where physicians are very, very experts in disease states and management of a specific vertical. Nurses had a knowledge and an understanding in our hospital systems, which we were allowed to bring to the forefront to create new protocols, new ways of managing patients in a way that you needed that whole view. One thing that I think is an excellent point is to Nicole's point, we do a great job of managing the patient and getting to know who they are and seeing the human and creating those experiences. But one of the most fundamental points that COVID has showed us is the importance of the nursing expertise to drive forward operations to save patients' lives faster. We recognized where the breakdowns were. We know where the interoperability exists. We knew that by delivering medicine the way that we had before was not going to work in this crisis. And by seeing that and bringing nursing to the forefront, many hospital systems have averted many disasters and patients' lives lost because of looking to the nurse to sit there and say, hey, how can we deliver medicine differently? How can we treat patients who are in full infection precautions differently in a way that keeps everyone safe? And those are some of the things that we're seeing with COVID. These are some of the ways that a vaccine, when that comes forward, means that we as nurses are going to be able to do our jobs better, safer, but more importantly, we ourselves also are going to be protected for the first time going in, because every time we cross that threshold right now, there's a risk that you're bringing it home to your family. All of us know loved ones that have gotten sick from this infection, that have potentially brought it home. And by doing a vaccine means that for the first time, when that crosses the threshold, there's hope that not only do we protect our patients, protect ourselves, but we protect our loved ones as well. So it's absolutely critical to being able to conduct healthcare to the top of the way that we want to, and it's absolutely pertinent to being able to reopen the society in the way that we want to.
I'm so happy to hear that nurses finally feel like they're being recognized, their voices are being recognized. I have a question from Hebatula from LinkedIn, who asks, do you think wearing masks can assure 100% protection against COVID? Nicole?
No, I don't think wearing masks assure 100% protection. I think that hand washing is equally as important. And I also think that it's very hard and not really realistic for people to wear their masks 100% of the time for a 12-hour shift. And so even if you're not catching it from a patient, you might be catching it from a coworker. And and to speak to your question about the vaccine, I think that that's what the nurses really need, because even though we're the heroes, everybody's talking about nurses are heroes. Nurses also feel they're an infection risk, and it's I haven't seen my parents because you don't want to infect those that are at highest risk. And so we know that healthcare workers are at an increased risk, and masks are not 100% a surety. So the vaccine will really bridge the gap. I think it won't give us 100% either. I don't think, as we know with the flu vaccine, it's not 100%, but it will make a tremendous impact on nurses being able to live a normal life and see their family and hug their kids and all the things that we haven't been able to really do.
Nicole, Lincoln, Rebecca Love, thank you for everything that you do and for advocating on behalf of your fellow nurses. Thank you so much for taking the time to be with us today.
Thanks for having us.
Now, in case you're just joining us, I'm Lisa Ling, and this is The Road to a Vaccine, a weekly exploration of the COVID-19 crisis and the global community's efforts to develop a vaccine against the disease. Keep asking questions, put them in the comment section, and we will do our best to get as many as we can. Now for Vaccines 101, our weekly segment about the process of developing a vaccine. We know there are quite a number of vaccines being developed, but what does it take for a vaccine to get into clinical trials? To help shed some light on the whole process, we have Dr. McKenna Duogi, Head of Clinical Development Vaccines at Janssen. When the Ebola epidemic emerged 6 years ago in West Africa, she led the company's accelerated clinical program to get a vaccine to people in emergency circumstances. And now with the outbreak of COVID, she has just been working tirelessly since January. Dr. Deoji, thank you so much for being with us. Now, the world is anxiously awaiting a vaccine, so there are a lot of questions about how it's tested. So given the emergency situation that we're in, vaccines are going into clinical trials on just this accelerated timeline. So what has to be achieved before a vaccine candidate goes into clinical trials?
So Lisa, normally what you need to do are preclinical studies, which are animal studies, and there's some critical things that you need to evaluate before you can move into clinical trials. And I'll talk about a couple of exceptions there as we go along. So you do need to show that your vaccine generates an immune response in animals. You also need to show that it protects against infection or disease. And that's established in specific animal models, so that really there's some confidence that what you will ultimately inject into humans does generate the type of response that you're expecting and anticipating, and it does show some level of efficacy in animals. You also need to typically do toxicology studies. So you vaccinate the animals and you're just looking for any adverse effects. For platforms such as the one that we're using that we've used for Ebola, a number of our vaccine programs, but also currently for COVID, sometimes platform data can actually you can leverage from a safety perspective. So when I mentioned toxicology studies, if you have substantial data, sometimes the regulators allow you to move faster because of the experience that you have, not only in animals, but also in humans. So those are some of the considerations that you need to have from a preclinical perspective in terms of studies before you can move into clinical trials. On the manufacturing side,
when you talk about the regulators, are you talking about the FDA, and are they working alongside you during the trials?
Yes, and we can arrange to have interactions with them, and usually we present the package that we have in mind that we think will be adequate to support going into human trials, and have a discussion around that. And so if there are additional things we need to do, we can address that, and we try to have those meetings as quickly as possible, especially in the context of a pandemic. You want to have those conversations early to ensure that you're on the right track and you're generating the sufficient information to go into clinical trials. So on the manufacturing side,
curious. Oh, sorry. I really am just so curious about how. Oh, sorry. Go ahead, McKenna.
No, just on manufacturing, you also need to make sure that you generate clinical trial materials to make sure that you have a sterile product that's going into people, and you need a certificate of analysis just to show that it's safe for use in humans. So those are the two pieces that you generally need to put into a package for your application.
I'm so sorry, Micaiah. Can you explain the different phases of the trial, and how will we know when it works? What exactly do you have to prove?
Sure. So you start out, your first trials are phase 1 studies. Those are typically very small studies. You'll have healthy volunteers who are participants, and you evaluate in the tens to hundreds of individuals, depending on what your questions are, how many dose levels you'd like to evaluate. And the main focus is safety. And then secondarily is looking at that immune response to make sure that it's generating the types of immune readouts that you would expect. It can also give you information on what dose you'd like to select. And then when you do phase 2 studies, it could be in the same population or in special populations, additional populations, older adults or younger children, for example. Then you're looking at expanding that safety experience and also getting a broader perspective on the immune readouts in a larger number of people. Usually it's a factor of 10 that you can increase between phases. There are phase 2A studies, which really focus on the immune responses and safety. And then phase 2B is actually an efficacy study, a proof of concept, where you can get an early readout on a relatively small number of individuals to understand if your vaccine works. And to do that, you need to vaccinate people, a certain number of people. They receive active, or they might receive a control vaccine. And then you monitor for the development of cases. And you can define a case as severe disease. It could be prevention of infection. And once you're finished that study and you've selected those events, you understand how your vaccine works. And so that's what you would be. Sorry, there's an echo. That's what we'd be trying to
Oh, we have a little bit of feedback.
Apologies, there's just some interference, but that's what we will be trying. That will be the earliest signal where we will be able to understand if there is, if our vaccine is efficacious, is really testing it in a setting where people could be at risk of acquiring the disease. And then your phase 3 studies are your pivotal efficacy studies. There are other studies that you might do in parallel to make sure that your manufacturing process is consistent. But again, you're looking to show in sufficient numbers to give definitive evidence that your vaccine either protects disease and or infection. And you may look at some other parameters as well that also could include safety. So the challenge with COVID and any other epidemic is that you've got to work quickly, and there are lives at stake. And so anything that you can do to accelerate the time between each study, the time between when you start and when you get your results is absolutely critical. And so the general development plan is often sequential, and I think in these pandemic type situations, you see a lot being done in parallel. And of course, taking safety into consideration, and like I mentioned, platform data really can help there.
And where will these trials be conducted, and in what ways do you chase the virus? I heard that that's a big part of what you do. You chase the virus.
Yeah, and that is one of the key questions. And I think if you look at something like influenza, that has a seasonal pattern. You need to vaccinate people before the season starts. With a pandemic where we're not really sure what's going to happen, you really have to pay close attention to the epidemiology. And it's exactly what you said, you need to chase the virus. So where is there active transmission? Where are there susceptible people? Where are the clusters of cases? And so normally when you set up a trial, you sort of know, okay, we're going to be in this area and this area, and then this is how our trial will go. I think for COVID, the consideration is where is the disease, where are there active pockets, because you have to vaccinate people before you know whether or not they will have the disease. So it's kind of a question mark to a certain extent. And so we need to be ready broadly in broad geographic areas to really be able to say, okay, we'll activate a site here and a site there to be able to get that efficacy signal. And it's difficult to predict today what will be happening in a few months, and that's the other challenge. So we're looking at maybe modeling and collecting all the information that we know today to really sort of predict where might we need to be. Not the easiest
Wow, this
thing
process
to
is,
execute.
yeah. The process really sounds so overwhelming, but it's something that I'm truly fascinated in. So I hope that you'll join us again, because I really want to try and sort of follow this step by step and find out, where you are in the process. So Dr. Makaya Deogi, thank you so much for taking the time to be with us. I'm sorry I messed up your name in the beginning and I stepped on you, but we had a little bit of a delay, but I so appreciate the information. Now, this is the Road to a Vaccine, and we are live right now discussing the COVID-19 crisis and the global community's efforts to develop a vaccine against the disease. Remember, if you have questions, please put them in the comment section, and I will be asking them throughout the show. Our next guest is someone I really admire. Arianna Huffington is the founder of Thrive Global, and well before COVID, she made it her mission to improve people's mental health resilience and productivity. And now she's partnering with the entertainment industry to help our frontline healthcare workers with essential supplies, childcare, and mental health support. Arianna, thank you so much for being with us. Now, you've been talking about mental health balance and resilience for years, and yet now we're facing a crisis unlike any other. So can you talk about the mental health crisis that's just being exacerbated by COVID, and why are you lending a voice to this now?
Lisa, first of all, thank you so much for what you're doing and for this show. Mental health problems have been challenges we've been dealing with even before the pandemic. It's really a crisis of global proportions. But right now, as you said, it's being exacerbated by this unprecedented uncertainty, stress, fear, and anxiety that the pandemic has provoked. At the same time, in all the work we are doing at Thrive with many companies like Accenture, Bank of America, Verizon, Walmart, we are seeing that this time is also a catalyst for fundamental changes. Because as you know, changing human behavior is incredibly hard. Yet a lot of our mental health problems are lifestyle related. They are based on the way we've been living and working, fueled by burnout and stress and an always on frenetic way of working. Now we have an opportunity to realize, A, this is not the most effective way to work. We have a lot of data that show that taking time to recharge actually improves our performance, as athletes have shown again and again. But also to recognize that in a time like this, we absolutely have to, because we don't have many reserves. And new studies now out of Yale show that our brain, when it is in a permanent state of stress, as we are right now, basically weakens the prefrontal cortex where our decisions are being made. And as a result, we are much less productive. There has been, Lisa, a 300% increase in Google searches for how can I get my brain to focus.
Well, Arianna, surviving is one thing, but you believe that it's possible to even thrive in this kind of environment. How do you suggest we get to that place where we can feel like we are thriving?
Well, I think this is a time to look at what didn't work before the pandemic. I mean, we're all nostalgic for so many things, including even our commutes. But we need to acknowledge there was a lot that was not working. The World Health Organization had acknowledged burnout officially last spring as a medical syndrome. So that way of living and working had led to the mental health crisis we mentioned, and also a dramatic increase in chronic diseases like diabetes, like hypertension. And now we have an opportunity to realize there is another way to work and live. It requires a mindset shift, the recognition that we can be incredibly effective and productive, indeed much more effective and productive, if we take time to recharge. At Thrive, we've launched a behavior change app that has these 4 journeys, Lisa. The first is recharge, which is about sleep, which is foundational to our mental health and immunity, and 60-second breaks during the day to actually focus on our breath, consciously recharge, and course correct from the inevitable stresses of the day. The other journey is fuel. What are we eating and are we moving? We've seen, unfortunately, some bad stats during the pandemic that people are regressing to drinking more, alcohol sales are up, and to stress eating. So recognizing that there is a connection between the sugar and processed foods we are eating and our physical immunity can help us take micro steps. We believe in micro steps every day to improve that behavior. The third journey is around focus, which we mentioned has been much harder right now. How can we avoid distractions? How can we do very practical things? Like I have personally ended all notifications to my phone. I don't want to be receiving breaking news. First of all, as you know, 90% of the time it's not breaking news. And second, I will go and get the news when I want to get the news. I don't want to be interrupted. So we can all take micro steps like that protect our attention and improve our productivity and mental resilience. And the final one is around connection. This is a time of social distancing, but it doesn't have to be a time of disconnecting from friends, loved ones. But connection starts with connecting with ourselves. If we are disconnected from ourselves, it's going to be much harder to connect with anyone else.
Yeah, Ariana, these tips that you are suggesting are very simple, but they do make a significant amount of difference. And it's so true. Even before COVID, we were in the midst of a mental health crisis, and now it's more important than ever to take these little steps on a regular basis to take care of our mental health. Now, you were talking about the stresses of being overworked, and currently our first responders, that is exactly what has been happening to them. And you are helming the First Responders First program, which is this massive relief effort pulling celebrities together and businesses to support frontline healthcare workers. What is the program's mission, and how specifically is it helping these people?
Actually, the First Responders First was launched by Thrive Global in partnership with the Harvard School of Public Health. Dean Michelle Williams has been a big proponent of mental health for frontline healthcare workers. So in partnership with the School of Public Health at Harvard and CAA, Creative Artists Agency, we have tried to provide a whole human solution for first responders during this crisis, which means obviously we need to do everything we can to help provide protective equipment, but also they have other needs, childcare, accommodations, and mental health support. Working, and we're partnered with J&J on that to eliminate the stigma of frontline healthcare workers around seeking support, and also arming them with these micro steps that can help them during the day get these little micro breaks. Truly, Lisa, it's kind of amazing to see the science that shows that in 60 or 90 seconds, we can course correct from stress. So that stress doesn't become so cumulative that by the end of the day, they can't unwind, they have a hard time sleeping, which creates this vicious cycle. So we've offered webinars, mental health support, and also the recognition that this is essential, because the more depleted you are as a frontline healthcare worker, the more risk you are facing in terms of your own health, but also the less effective you're going to be in taking care of others. You know, I've always loved the fact that a doctor attending to someone in cardiac arrest, the first procedure in the protocol, Lisa, is take your own pulse. How are you doing as the attending physician? Because if you are stressed out, if you're not centered, you're not going to make the best decisions. So we need to kind of reframe taking care of yourself as a first responder from something that's self-indulgent to something that's essential in order to do your job right.
Well, first, frontline healthcare workers are just being asked to do so much, and there's such a high expectation of them. I want to get to a question because we have a lot of questions coming in. I want to at least get to a couple. Lauren from Facebook asks, how can we mentally support our frontline healthcare workers?
Well, I feel it's very important, first of all, to do everything we can to protect ourselves so we don't burden the medical system. So everything that has been asked of us, you know, staying home, wearing face masks, we need to take all that seriously. And even in states that are reopening, making sure everything is done with extreme care and vigilance, because any spike in coronavirus cases will affect frontline healthcare workers first. Then donating to any organization that supports them. First Responders First has raised over $7 million, but there are many good organizations that support them. And I always believe in even giving $5 or something adds up in ways that really make a difference at this time.
Yeah, and Arianna, we had two incredible nurses on earlier who said they still don't have enough PPE. So all of that contributions, donations, they all help. I want to ask one more question from LinkedIn. Ashish says, many people are panicked with constantly reading news, hearing stories on COVID-19 and scared. So what can be done to help those people who are just constantly immersing themselves and going down the rabbit hole of reading news about COVID-19?
Stop it.
I'm one of them.
I really feel so strongly about that. One of our recommended micro steps, Lisa, for frontline healthcare workers and for all of us is establish a social media and news cutoff time. When you stop consuming news and social media, because as you're getting ready to transition to sleep, which is so key and so foundational for our immunity and our mental resilience, the worst thing you can do is read something that stresses you out. And is there anything you read that doesn't stress you out? Well, there is some good news in terms of people's generosity and creativity during this time. But why put yourself at risk of reading something that stresses you when there is nothing you can do about it, and when our priority should be preparing ourselves for sleep so that we can get what our system needs, which is that time to recharge, that time for our brain also to get rid of all the toxins that have accumulated during the day and be able to deal with the challenges of the next day. So we need to be very disciplined and rigorous with the cutoff times, as I said earlier, ending breaking news notifications and protecting ourselves, from
Arianna, I couldn't agree with you more about cutting yourself off. I mean, I'm as guilty as anyone for reading about exactly this. The other night, I was sleeping with my girls, don't judge me, and my daughter woke up at 3 a.m. and she was just staring at me. And I said, Jet, why aren't you sleeping? And she said, because you're thrashing around and screaming. And I think it had a lot to do with the fact that I went to bed reading about everything that was happening. So that suggestion to cut yourself off before you're about to go to bed, I think is a really important one.
Oh, Lisa, if you do that, please write about it, even a paragraph or two. We'd love to publish it, because then so many people who admire you will actually be more likely to do it themselves. We are finding that role modeling this behavior, taking these steps, helps spread them.
Well, Arianna Huffington, thank you so much. It's important for everyone to know it's certainly not a bad thing to want to stay abreast of things that are occurring, especially as it relates to COVID. But maybe just before bed, just cut yourself off so that you are able to get a good night's sleep, because that is so crucial in protecting your mental health. Arianna Huffington, thank you so much for taking the time to be with us. And we are hearing so many perspectives on the mental health challenges of the disease. And I thought it would be great to hear from someone who has had COVID and come out of it on the other side.
Hi, I'm Michelle Elman, and I got COVID-19 about 2 months ago. The first symptom I had was shortness of breath, and then over the next few days I developed a dry cough and a fever. It took me probably about 2 weeks to recover, but the shortness of breath definitely stuck around longer than that. It's only really been in the last week that I've been able to go back to normal exercise. For anyone who thinks this isn't real, it most definitely is. Don't wait until it happens to you or a loved one until you start taking it seriously. The measures that are taking place across the world are to keep us all safe and to protect us, and they're really important. For anyone struggling with their mental health, I totally get it. Being ill alone is a really horrible process, and I wouldn't wish it on anyone. The main thing I can say from my experience is that you are stronger than you will ever know, and you will get through this, and this pain is temporary. I've had a number of hospitalizations and also surgeries, and the main thing I remember at that time is that statistics don't matter if you're the individual. You don't need to keep looking at the numbers. You don't need to keep worrying and scaring yourself. Focus on your own recovery, and that's all that matters. You're going to get through this.
And that was Michelle Elman, author and life coach, sharing some important lessons that she learned from her experience battling the disease. Our next guest was named a health hero by O Magazine, Dr. Husseini K. Manj, who leads J&J's large-scale collaborative initiatives aimed at understanding the science behind mental health, is with us today. And since May is Mental Health Awareness Month, he's here to talk about the mental health impact of COVID. Dr. Husseini, thank you so much for being with us. Now, we were just talking to Arianna Huffington about the fact that mental health was already a major public health issue before COVID, yet these issues are being compounded by the current crisis. Last week, the Washington Post published an article about how the coronavirus pandemic is pushing America into a mental health care crisis, or a mental health crisis. So can you talk about how this pandemic is impacting mental illness in this country and abroad as well?
You're very correct, Lisa. We really are starting against the backdrop of a mental health crisis that already exists both in the United States and globally. For example, just to give you some statistics, in the US alone, it was estimated that 1 in 5 adults suffered from a mental illness in 2018. And you're aware of the suicide statistics. It's increasing at an alarming rate. Moreover, scientists have learned a lot about the risk factors for mental illnesses, and these include both biological factors as well as psychosocial stresses. And unfortunately, some of the key psychosocial stresses are those we're witnessing in our current pandemic. And just some of those include acute and prolonged distress, the loss of a loved one, economic distress, and social isolation. So you can see how these would converge together. If you wouldn't mind, I'll just provide you with some context why we're all feeling the stress of COVID-19. Arianna alluded to this briefly. When we're faced with a threat, we experience this physiological response where we activate a part of the brain called the limbic system, which mobilizes what we call our flight or fight response. And this is actually very adaptive. It's there to help us, and it should subside. However, the threat of COVID-19 has become chronic and sustained. And so this frequent and prolonged what we call hyperarousal of the mind and body can result in a sustained overactivation of the system and have a deleterious mental health outcome. And just to touch on a couple of additional biological factors, there are numerous reports of neurological symptoms with COVID-19. So like many of the viruses, it's also possible that there are direct brain effects of SARS-CoV-2. And also we know that some of the body's immune responses, for example, activating interleukin-6, can trigger or worsen depression. So you can see that, unfortunately, the COVID-19 pandemic has a potential to turn up the volume on all these factors. And indeed, similar events in our past sort of bear this out. The data compiled from researchers from events like 9/11, the Great Depression, and the SARS outbreak in 2003 show an increase in mental health issues and substance abuse disorders. Now, based on research,
I think the uncertainty of all of this is really contributing so much to this. I mean, as you said, some people are even exhibiting signs inside their brains of COVID, and I think that is, the unknown for people is what is hugely concerning.
That there's absolutely no doubt. So if, not knowing what's coming, having the fear and anxiety, and not feeling in control. And many things you talked about in the previous discussion about the bombardment of the news cycle and hearing about all these things, etc., is one of the things that's contributing. And so some of the things we actually recommend is to try and dampen your overactive immune system. And Arianna touched on some of those things. So, meditation, deep breathing, sort of rest, exercise, sleep, those all dampen the immune system. And then there's something called top-down control. So again, the prefrontal cortex is there to sort of help suppress some of this catastrophic thinking. And if you can start to recognize that there are some things out of your control, but there's many things in your control, and focus on those things that you have control over, and start to get away from this sort of catastrophizing where there's this downward spiral, that will help you. We've taken the liberty of putting together a graphic, which we may project now, that sort of helps us think what we might see with the COVID-19 crisis, because it sort of parallels what we've seen with some other situations, namely that unfortunately, with the COVID-19 crisis, we may see a mental health impact which will actually persist beyond the acute COVID-19 crisis. And indeed, we may see this impact not only in people with pre-existing mental health conditions, but exactly as you said, all of us. We can be susceptible to the fear, the worry, the anxiety, and that can cause this mental health distress that we need to try and do something about. And you alluded to that Washington Post story. Most of us think that we really need to come together as a society and do something about it. If we don't get ahead of it, we're going to be faced with the mental health impact for years to come. And I'm glad to say that the mental health community has, in fact, been coming together in many ways.
Well, yeah, I understand that the mental health community is really mobilizing, because at this point, are enough resources available for people who are dealing with mental health issues?
Yeah, I'd say it's definitely a bad news, good news picture. If I can start with the good news, society is sort of mobilizing, and professional societies like the American Psychiatric and Psychological Associations, the National Association of Social Workers, and others are mobilizing a tremendous telehealth effort, which is trying to provide, sort of telehealth to people who might be struggling with these conditions. Mental health professionals are also supporting those on the front line. I couldn't agree with you more. The frontline heroes, they're putting their lives on the line for us, and they put themselves under unimaginable amounts of stress. So as Arianna mentioned, we know that they're resilient. We know that they're the best of the best, but they're human too. And we need to point out to them that there's nothing wrong with getting help for yourself. It's not a sign of weakness. In fact, even things like the special forces focus on mental health and resilience because it makes them do their job better. I'm pleased that organizations like CMS are allowing reimbursement for telehealth services, and this includes for mental health. And then a number of organizations, the National Alliance of Mentally Ill, Mental Health America, National Institute of Mental Health, and others are providing online resources to help people understand how to get help. And in this context, as you heard from Arianna, Thrive Global, my good friend Michelle Williams, the Dean of Harvard School of Public Health, CAA, and J&J are also coming together to provide tools. So that's the good news. But the bad news, there's no question we need to do much more. So first and foremost, we collectively need to increase awareness about mental health, dispel the stigma of mental illness, and use the best science to help individuals and families. Secondly, it's more important than ever to ensure that mental health conditions are treated the same as physical health. And this also includes ensuring full access to treatment and care. And, perhaps this crisis we're in will spark some reforms towards that. And then thirdly, we should recognize that while everyone is experiencing increased stress, we really need to identify and deliver evidence-based treatments to those who are going to suffer even more deleterious consequences like PTSD or depression. But I remain optimistic that if we can come together as a society, help our fellow man stay strong and resilient, we can really come out of this stronger than ever. So I really hope we can.
Dr. Husseini, I just want to take one question from someone watching. Donna from Facebook asks, what do we do about kids showing signs of depression and fear?
Yeah, so I think that's a very important consideration. You alluded to your own example, with your daughter.
Yeah.
I think sort of, again, a good news and a bad news picture. The kids, they'll sort of model what we're doing. They'll react to what we're doing. So if we as adults can set the right framework, we can sort of follow the best practices, the face masks, the social distancing, the hand washing, etc. We can limit our news watching so that they do the same. Then kids are very socially connected. So we've got to make sure that they're not overly socially connected and getting bombarded with some of these, sort of negative messages and the catastrophic thinking, but rather they focus on the positive aspect. Connect with friends, focus on activities that can keep them socially connected even while they're physically isolated, etc. And then just like adults, if it gets to be excessive, there's absolutely nothing wrong with reaching out to a pediatrician or to a healthcare provider to make sure that this hasn't sort of tipped over to the point where you need some sort of clinical intervention. And the clinical intervention could certainly include, sort of different kinds of psychological, behavioral, stress reduction, etc.
It is so true. Taking care of our mental health is absolutely as important as taking care of our physical health. Dr. Husseini, thank you for taking the time to be with us. I really hope this episode has been a reminder for everyone watching that it is okay to ask for help. Please keep submitting your questions to jnj.com/road-to-a-vaccine, and we'll be answering more next Tuesday on another live episode. And next time, we'll be talking about how we prepare for large-scale manufacturing of a vaccine. I want to thank our guests for joining us today and to all of you for watching. You might remember last week we had Dr. Ed Kuffner on the show, and his daughter made this wonderful tribute to our amazing nurses on International Nurses Day. Thanks for joining us.
To all the doctors, nurses, and medical professionals working around the world to stop this global pandemic, we would like to say thank you.
Gracias.
Thank you.
Merci beaucoup.
Hvala vam I ostanite jaki.
Muchísimas gracias.
Tusind mange gange tak.
Muchísimas gracias por todo lo que hacéis.
Tack så mycket.
Auja.
Gracias por el apoyo.
Abaraka.
Mange tak.
Khopun ka.
Muchísimas gracias.
Thank you.
It really means a lot to not only me, but many people around the world. And again, I just want to thank you.
Köszönöm szépen.
Thank you for your help and support. It is greatly appreciated by everyone.
Danke, dass ihr für uns da seid.
Terima kasih.
Hvala vam za sve. Puno pozdrava iz Hrvatske.
Gracias.
Saludos desde México y muchas gracias a todos.
Tusen tak for din hjälp.
Big thank you to all the healthcare workers helping us during this crisis. Lots of love.
Muchas gracias.
Thank you.
Dankeschön für eure Unterstützung.
Because without you, who knows what we would do?